Hi everyone, I'm going to be talking about the vasculature, the musculature, as well as the skeletal features of the hip and the thigh. So I hope this video is educational and I hope you enjoy. Alright, so I'm going to be talking about the hip and leg bones. So the first bone of the hip is the ilium. As you can see, it's highlighted here. There's a left and right, and it's one of three, as I mentioned, the other being the ischium and the pubis. It articulates with the ischium, the pubis, the sacrum, and the femur. And this is kind of what is going to be jutting out. You feel that in your hip, like your hip bone when you bump into it and stuff. And then there's it on the other side. And then we also have the pubis, right and left as well. This is also a part of the hip bones, and it articulates with the ilium, the ischium, and the femur. And then we have the ischium, which articulates with the ilium, the pubis, and the femur as well. And this is the third bone of your hip bones. We have the femoral head that goes into the acetabulum. That's kind of like the ball and socket that we see, because it's a ball. Our hip is a ball and socket joint. And then the largest bone in our body, the femur. The femur is going to articulate the hip bone, the tibia, and the patella. And as you can see, it's an incredibly long, thick bone here. And again, right and left as well. And here's more of a better view of that femoral head right there. This isn't technically a hip bone, but the sacrum does articulate with a lot of the hip bones, so I'm going to mention it quickly. It articulates with the fifth lumbar vertebrae and the cocci. It's an irregular bone, and it's one of the 5 regional groups of the vertebral column. But like I said, it does articulate with a lot of the hip bones, so I thought it would be worth mentioning and noting where that is. Okay, so that was more generally some of the bones of your hip and your thigh. So now I'm going to get into some more particulars about some of these bones. For the ilium, we have the ala, which is this pink part here. It's that big wing-like structure, and it fans out, and it's superior located and pretty thick. And then we have the body of the ilium, which is that middle section right there, again, that you can see highlighted in pink. And yeah, like I said, it's that middle section right there, and it's going to be inferior located. And then we have the body of the ischium. This is going to be posterior located, and again, it's what's highlighted in pink. We have the body of the pubis as well. And this is going to be medially located, and it's like a quadrilateral shaped part of the bone. And again, that's going to be in pink. We've got the inferior pubic ramus. It's also inferior located, and it's going to be a flat bony bar that projects out of the lateral aspect of the body of the pubis. And then we have the ramus of the ischium. This is going to be flat bony, and it's going to protrude from the inferior portion of the body of the ischium. Then there's the superior pubic ramus. This obviously insinuated by the name. It's going to be superior located, and it's going to be the bar that projects from the lateral aspect of the body of the pubis. And then we have the obturator foramen. It's a large oval opening in the anterior inferior part of the coxal hip, or the hip bone. Now for the parts of the femur, in pink we've got the body of the femur. This is the shaft. It's the long structure that makes up the majority of that femur. And then we've got the greater trochanter, which is going to be that large, very big, protruding aspect of the femur that is going to be in the superior portion of the femur. We've got the head of the femur, the femoral head. That's what goes into acetabulum to make your hip and socket joint, which is ball and socket. Sorry, ball and socket allows for a lot of range of motion. And then we have the intercondylar fossa, which is a notch of the femur, and it's a depression found along the posterior or inferior aspect of the distal end of the femur. We also have the lateral condyle of the femur. As you can see, it's going to be on that lateral aspect of the bone, and it is external. It's the external condyle of the femur, and it is laterally located. It's round, and it's articular eminence on the distal end of the femur. And then we have a lesser trochanter, which is just going to be smaller than that greater trochanter that you can see above it. And this is a blunt conical protrusion on the proximal end of the femur. We also have the medial condyle, so this is going to be on the medial aspect of your femur. It's an internal condyle of the femur. It is medially located. Finally, we have the neck of the femur, which is what attaches the shaft or the body of the femur to that femoral head right there. Okay, now to speak to some of the muscles of your hip and your thigh. To start, we have the iliacus muscle. This is bilateral. There's a right and left. The origin is at the iliac crest in the superior 2/3 of the iliac fossa, as well as the ala of the sacrum and the anterior sacroiliac ligaments. The insertion is at the lesser trochanter of the femur via the tendon of the psoas major muscle. And this muscle is going to flex the hip at the hip joint and flex the trunk. We also have the obturator externus. This is again going to be bilateral. There's going to be right and left. The origin is going to be at the external surface of the obturator membrane and adjacent bones, and the insertion is going to be at the trochanteric fossa of the femur. And this muscle is going to laterally rotate the thigh at your hip joint. And again, we've got right and left there. And then we have the adductor brevis. This is also bilateral. The origin is at the body of the pubis and inferior pubic ramus. And the insertion is going to be at the proximal 1/3 of the medial lip of the linea aspera of the femur. And this muscle is going to adduct the thigh at the hip joint. As we see here, this is the motion that the adductor brevis is going to be doing. It's hip flexion. And here we see the obturator externus, which is going to be hip lateral rotation, which is what we can see in this animation here. And finally, we have the iliacus muscle, which is again used for hip flexion, as we can see in the animation. For other muscles of the thigh, we have the sartorius muscle, which is also bilateral. The origin is at the anterior superior iliac spine, and then the insertion is going to be at the medial aspect of the proximal part of the tibia. And this is going to flex and medially rotate the leg at your knee joint. And it's going to assist in flexion and AB abduction and lateral rotation at the hip joint. So I'm going to show hip adduction or abduction, abduction, as well as hip flexion here. And then we also have hip lateral rotation as well for the actions of this muscle. Further, I'm going to take off a layer of muscle here. We also have the rectus femoris muscle. This muscle is going to be for knee extension as well as hip flexion. We've seen the animation of hip flexion, so I'm not going to show it again. But the origin for this is at the anterior inferior iliac spine. The insertion is at the tibial tuberosity via the tendon of the quadricep femoris muscle and the patellar ligament. And yeah, I already said the action for that one. Next, we have the vastus medialis muscle. This is going to be on the medial part of the thigh, and the origin is at the medial part of the intertrochanteric line and the medial to the spiral line in the linea aspera of the femur. And then the insertion is going to be at the tibial tuberosity via the tendon of the quadricep femoris muscle and the patellar ligament. And action is that it's going to extend the knee at the knee joint. And then we also see right here the vastus intermedius muscle. So this is going to be in between the two other vastus muscles. Its origin is anterior and lateral surfaces of the body of the femur, and then the insertion is at the tibial tuberosity via the tendon of the quadricep femoris muscle and the patellar ligament. And the action is it's going to extend the leg at the knee joint. Finally, for the vastus muscles, we have the vastus lateralis muscle. Again, this is going to be lateral aspect of the thigh, and the origin is at the intertrochanteric line, the greater trochanter, gluteal tuberosity, and the lateral lip of the linea aspera of the femur. And then insertion is at the tibial tuberosity via the tendon, the quadricep femoris muscle, and the patellar ligament. And the action is that it's going to extend the knee at the knee joint. I mentioned the adductor brevis. We also have the adductor longus muscle. The origin is at the anterior surface of the body of the pubis, and the insertion is at the middle 1/3 of the linea aspera of the femur. And the action is that it's going to adduct the thigh at the hip joint. And like I mentioned, we have the adductor brevis as well. We also have the pectineus muscle, which the origin is at the superior pubic ramus, and the insertion is at the pectineal line of the femur, and the action is that it's going to adduct, adduct, and flex the thigh at the hip joint. Finally, we have the psoas major muscle. The origin is at the transverse process of L1 and L5 vertebrae, the vertebral bodies of the T12 through L5 vertebrae, and the adjacent intervertebral discs. The insertion is at the lesser trochanter of the femur, and the action is that it's going to flex the thigh at the hip joint, and it also flexes the trunk. Okay, so now let's talk about vasculature coming into the hip and thighs. We have the common iliac vein, which splits from the inferior vena cava. The origin is at the union of the internal and external iliac veins, which are right below it. The internal as well as the external iliac vein, as we can see there. And the common iliac vein is going to ascend obliquely to continue as inferior vena cava at the 5th lumbar vertebrae. And yeah, as I mentioned, we have the external iliac vein right here, which comes and joins with the internal iliac to form the common iliac vein. And then, as mentioned, that's where the internal iliac is as well. We also have the femoral vein, which is a pretty large vein that supplies the femur. It ascends posterior laterally to the femoral artery and continues as the external iliac vein, which is right above it, as we can see. We also have the great saphenous vein. This is bilateral, and this takes a long course from the foot to the proximal thigh to drain into the femoral vein. So this is an extension off the femoral vein, which we just talked about earlier, and the drainage is into the foot and the leg. We also have the deep femoral vein. This travels between the adductor muscles to join the femoral vein in the anterior compartment of the thigh, and this is going to drain into adductor, extensor, and flexor muscles of the thigh. We have the superior gluteal veins as well, which is where my cursor is right there. And this is going to pass through the greater sciatic foramen to drain into the internal iliac vein. And this drains the muscles of the butt, the upper thigh, and the hip bones. There's also the superficial circumflex iliac vein, which travels inferiorly and medially to drain into the great saphenous vein, or the femoral vein. And this is going to drain into the inguinal region and the anterior abdominal wall. There's also the deep circumflex iliac vein, which travels along the iliac crest to drain into the external iliac vein, and the drainage is into the external iliac vein. That's going to be all for the veins, the muscles, as well as the bones for the hip and the thigh. I hope this was helpful and a good review from all that we've learned in this class.